Hi guys, and welcome back to the second video in the Better Squat series of videos on the Future Fit Pro Zone. My name's Andy and I'm going to be taking you through a few points today I think are important. But first we'll start with a quick recap of last week's video where we looked at posture and the importance of posture in deciding how someone squats, whether someone squats, what load they use when they squat. It's important to understand that if they can't stand correctly, they're not necessarily going to move correctly. If they don't move correctly, you're exacerbating the risks of injuries from what is undoubtedly a very useful and beneficial exercise. So we're going to start today with a few questions. So the first question is, quite simply, is squatting a good exercise? Now, I've used some light-hearted images here to demonstrate the bad side of the squatting exercise. We've all seen this within the gyms that we work and have been in throughout our time as instructors and trainers. And of course, there are these bad examples. But overall, is squatting a good exercise? Yes, of course it is. The thing to remember is that squats are a movement pattern. They're something that we are supposed to do in our daily life. They are a natural and a functional exercise. Therefore, if we move badly, we will squat badly. All of the postural misalignments, dysfunctions, muscle imbalances are going to cause a problem in the squat as they do when we are sitting, walking, or doing any of our other activities of daily living. The next question, quite simply, is the back squat the best squat to perform? Well, if you look at the lower level images here, you can see I've placed on lines where I think firstly the bar will be resting, so you can see that only on the correct or good posture image does the bar sit straight, the way we expect it to do, evenly across the upper back and shoulders. Equally, we then have to look at the direction the body will move should anyone exhibit these postural misalignments: scoliosis, kyphosis, lordosis, high hips, high shoulders. They're all going to create angles of direction which are putting excessive pressure on the intervertebral discs in our spine, especially if we are also under excessive load. So this comes back to the point that we were making in last week's video, which is the person right to squat loaded? And this, I hope, gives you an idea that not everyone should start squatting loaded. Now we have a very obvious question. Should everyone squat the same way? Well, initially, we're always taught to set everyone up hip to shoulder width, feet pointing ahead, toes turned out slightly, knees tracking the toes, chest up, head high, keep good posture throughout. And that is, of course, a very clear, simple, and a generic way of ensuring that people have a good start position. Now, the start position is only a small part of a squat. It's what happens as we start to descend through that movement and then rise back up through the next phase of the movement. This is where all the problems start to happen. If the person is tight across the chest, restricted mobility and flexibility in the shoulder girdle, poor abdominal strength, excessive lordosis, inflexible hips, tight calves, inflexible ankle joint, you're going to have some very bad squat issues. Equally, if we looked at the overhead squat that we looked at in the last video, you can see how the body starts to move out of alignment. You can start to see all of these muscle tightnesses, muscle weaknesses, and this is all going to exacerbate the movement. On top of that, you also have the simple fact that both biomechanically, structurally, we're not all the same. Our skeletons are slightly different. Our muscle attachments are slightly different because of these skeletal anomalies in between each individual. And therefore, having just a simple one-size-fits-all squat set up really isn't setting everyone up for the best possible results from those squats. So the big question really is, does the foot position or width of the stance change the muscles that are used in a squat? And the smaller question, does it really matter if you're not a pro athlete or a bodybuilder what position you set yourself up in, so long as those muscles are being activated and therefore being effective in the goals that you have set out for your client?
So the thing about foot position is this. Does it really matter? Well, yeah, of course, there are some caveats to that. You know, we can't have our knees tracking in a diagonal angle while our feet are splayed out. So, of course, there are, some common sense elements to consider here. But ultimately, what I'm trying to get across to you here is that we want to the comfort of the client is the thing that really matters here. And so often in the industry, we're talking about whether we go all the way down to the ground or not. And the position we set our people up in means that they have real problems going all the way down. So the question really is whether or not we worry more about the foot position than we do about what's restricting the movement. So the point I'm trying to make here, and it's something we'll look at later on in a little bit more depth, is that the foot position itself doesn't matter too much. Experiment with different positions on the foot. So we have the foot, somewhere between 30 and 45 degrees maybe. And we experiment with also width of stance to see which is more comfortable for our client. Because the truth of the matter is that the muscles that we use while squatting aren't going to change because of the setup of our feet and the width of the stance.
There is no way that the vastus medialis is not engaging in the exercise. We can't remove that from the movement and only have the vastus lateralis, vastus intermedius and rectus femoris working. Likewise, we can't remove the rectus femoris from the exercise whilst engaging the other three muscles of the quads. Equally, we cannot isolate elements of the hamstring. Okay, it's not how the body works. They work together. There's a reason why we have those muscles working as a group. And so the foot position and the stance really isn't the issue. It is a case of what's effective for the individual. Is it getting the outcome that we want from this? The key thing here is still safety and effectiveness and appropriateness of the exercise. So again, going back to it, find a position, experiment with different stances and foot positions until you get what works really well for the client. So here's why there needs to be the differences. Here you see two proximal ends of a femur. And as you can see, as they're laying flat on the table, which means the distal ends are both in the same position, you can see that the proximal ends are in completely different positions. Now this is of course an extreme example of the two different heads of the femur and therefore how they would sit in the acetabulum. But every angle from the one on the left to the one on the right is going to be in different humans, which is why instantly you can see, looking at this image, why you cannot just have everyone in the same position. You have to experiment with different positions and different angles to get the best out of the squat. Now here we see again two different femurs and the proximal ends of those femurs. And again, this is now looking at a different aspect, at the angle in which the head of the femur sits. So one is virtually out to the side and the other one is going up at a virtually 45-degree angle. Now I have to thank Ryan DeBell and the Personal Training Development Centre for highlighting these kind of issues in an article that he did for Personal Training Development Centre. And just these images show, again, why squats need to be set up differently for different people. And finally, here we can see that even if you get the angle of the head of the femur to be the same, the length of the stem of the head, the size of the ball that goes into the acetabulum in the hip is completely different. As you can see on the femur on the right, the greater trochanter is actually larger. It has a more of a bony process extending up at the top of it, which will affect the ligament attachments, the tendon attachments, muscle length, and also, of course, affect the movement that we have, how far down into the movement you can go, at what position the foot needs to be, and the width of the stance, all of which making a massive difference in how this exercise works. So lastly, the big question really is, how low should we go in the squat? How deep should we squat? A common question also being, but deep squats hurt the knees, don't they? My response to that would be, well, how do you think humans pooped before toilets were invented? In all seriousness though, when humans were pooping before toilets were invented, we didn't have loads across our back trying to impress everyone in the gym. So this image here just shows you an idea of whether or not we should squat full depth, and the fact that actually restricting movement creates more shearing forces through our cruciate ligaments than if we go full range, which is around about the 135 degree mark. Okay. It also looks at elements where the muscles are working to their best ability. So, you know, deep squats are definitely something that's beneficial, but equally they should be done correctly.
Okay guys, thanks for tuning in and listening to that. I hope you found it useful. Just a quick summary then of what we talked about during this video. So, one of the key things we talked about is whether or not we should all set up in exactly the same way. Well, when you've had your clients squatting, I'm sure you've noticed that their feet do strange things. Sometimes you have people with their feet gripping the floor, trying to keep themselves in the squat. Sometimes they rock back on their heels so that their toes are off the floor. And of course, sometimes they actually lift their heels off the floor to keep them balanced. This is due to muscle imbalances through the hamstring, through the calves, just lack of flexibility and mobility in general, really. We also talk about the stance, the width of stance that you should have. And we came to the sort of understanding that in reality, this doesn't affect the muscles that are being used. So experiment. Use different ones. Everyone sets up differently. And the reason for that being, well, look at what images were there for the heads of the femur. Alone, that's without us even looking into issues with the pelvis. They're different sizes, different angles, different lengths. It's creating all kinds of issues. And if we try and have this one size fits all aspect to squatting, we're ultimately going to create problems. On top of that, you add the postural issues, the misalignments, the dysfunctions, the weakness in the anterior or posterior chains, kinetic chains in the body. We'll have other issues too. So there's lots to consider when we squat, and that's before we even started to talk about the foot. And an excellent resource that I fully recommend is a book by Gary Ward called What the Foot. It just will completely deconstruct everything you thought you knew about functional aspects of training and what truly is functional and how our body should move and how we can start to put that right. It really is an excellent resource and you should consider having a look at that. So just to summarize, should we have the same foot position? No. Should we experiment with the foot position? Yes. Should we do the same with the stance? Yes. This will enable us to do and achieve the holy grail of squats, which the fitness industry is mad about at the moment, which is all the way to the ground. Should we do that fully loaded? There's another question and there's another video for us to discuss. The thing about that is, yes, we do all have the functional ability to squat full depth. Whether we should do that loaded or not is the big question. So thanks for tuning in, guys. Hope you found this really useful. As always, give lots of feedback to this. The more feedback we get, the more we can give you what you're looking for. Ask questions, we can come back with those too. Look out for coming up soon the live Q&A on Facebook's using Facebook Live. It's going to be a really useful tool to help us all move forward and grow and develop, which is what we want to do as trainers. So continue raising the bar and catch you next time. Thanks.